Artificial Intelligence Doctor www.abcpharma.net/English. User question: how does insulin resistance progress to type 2 diabetes in older adults? And what are the key biomarkers involved in this transition? GPT-4o answer. Insulin resistance is a condition where the body's cells do not respond effectively to insulin, a hormone that regulates blood sugar levels. This resistance can progress to type 2 diabetes, especially in older adults, through a series of steps involving several key biomarkers. Here's an overview of the progression and the biomarkers involved. Progression of insulin resistance to type 2 diabetes. Insulin resistance. 1. Initial stage. In this stage, the body's cells, particularly muscle, fat, and liver cells, become less responsive to insulin. 1. The pancreas compensates by producing more insulin, hyperinsulinemia, to maintain normal blood sugar levels. 2. Compensation. For a while, this compensatory increase in insulin production keeps blood sugar levels within the normal range. Impaired glucose tolerance. 1. Glucose levels rise. Over time, the pancreas can no longer produce enough insulin to overcome the resistance. 1. Blood sugar levels begin to rise, especially after meals. 2. Pre-diabetes. This stage is often marked by higher than normal blood sugar levels that are not yet high enough to be classified as diabetes. 2. It is also known as impaired glucose tolerance, IGT, or impaired fasting glucose, IFG. Beta cell dysfunction. 1. Decline in insulin production. Continuous demand for insulin overworks the pancreatic beta cells, leading to their gradual dysfunction and eventual failure. 2. Insufficient insulin. The pancreas can no longer secrete enough insulin to maintain normal blood sugar levels, leading to persistent hyperglycemia. Type 2 diabetes. 1. Chronic hyperglycemia. Blood sugar levels remain elevated consistently, leading to the diagnosis of type 2 diabetes. Key biomarkers involved in the transition. Fasting blood glucose, FBG. 1. Measures blood sugar levels after an overnight fast. 1. An FBG level of 100,125 mg per deciliter indicates pre-diabetes, while a level of 126 mg per deciliter or higher indicates diabetes. Hemoglobin A1c, HbA1c. 1. Reflects average blood sugar levels over the past 2-3 months. 1. An HbA1c level of 5.76.4% indicates pre-diabetes, while a level of 6.5% or higher indicates diabetes. Insulin levels. 1. Elevated fasting insulin levels can be a marker of insulin resistance. C-peptide. 1. A byproduct of insulin production that can help assess how much insulin the pancreas is producing. 1. Lower levels can indicate beta cell dysfunction. Homeostatic model assessment of insulin resistance, HOMA-IR. 1. A calculation using fasting insulin and glucose levels to estimate insulin resistance. 1. Higher values indicate greater insulin resistance. Oral glucose tolerance test, OGTT. 1. Measures blood sugar levels before and after consuming a glucose-rich drink. 1. It helps in identifying impaired glucose tolerance. Lipid profile. 1. Includes measurements of cholesterol, triglycerides, HDL, and LDL levels. 1. Dyslipidemia, abnormal lipid levels, is often associated with insulin resistance and type 2 diabetes. Additional factors. 1. Inflammatory markers. Elevated levels of inflammatory markers like C-reactive protein, CRP, and interleukin-6, IL-6, are often seen in insulin resistance and can predict the progression to type 2 diabetes. 2. Adiponectin. Lower levels of this hormone, which is involved in regulating glucose levels and fatty acid breakdown, are associated with increased insulin resistance. 3. Liver enzymes. Elevated levels of liver enzymes such as ALT and AST can indicate non-alcoholic fatty liver disease, NAFLD, which is commonly associated with insulin resistance and type 2 diabetes. Monitoring these biomarkers in older adults can help in early detection and intervention, potentially delaying or preventing the progression from insulin resistance to type 2 diabetes.